Fighting COVID-19 fatigue, a federal survey is showing nearly half of all Americans are struggling, either with mental health issues or substance abuse. During this pandemic, teenagers and young adults appear to be impacted even more so. So how can we keep our minds healthy? How can we stay up amid so much uncertainty? Well, our John Genovese is talking with an expert about ways we can all make the day-to-day stress a little more manageable.
10 months of turbulence as this health crisis continues on. Kitchen tables becoming classrooms and offices, extended family connecting only through computer screens, and masks now as common when you're out and about as a shirt and shoes.
What I'm seeing over and over again is just people just feel so weighted down and just so tired of having to do that stuff over and over again.
Michael Klinkner is a licensed clinical social worker. Among his clients, and like the rest of the country, he's seeing a spike in drinking, drug abuse, impulsive spending, and gambling. COVID fatigue, he says, is really decision fatigue. People having to make choices about things that had been so normal, and they now feel carry so much weight.
Or like people at work about like, are they going into work? Are they staying home? If their boss decides that they have to go into work, what do they feel about that? How do what happens there? If you're a parent, do you keep your kid home? Do you send them in?
So his advice, make sure you're exercising, even just a 30-minute walk each day. Find time to talk with your friends and loved ones. Watch your drinking and keep especially addictive activities like video games and social media in check. And focus on what you can control, like meeting a new goal.
This is the time to get back on there, whether it's like to lose 20 pounds or get back to that hobby, or it's New Year's resolution time, and we know nobody sticks to those. But this is the time. You can do that right now. You have the opportunity.
He says it's proven isolation leads to a depressed mood. If you or someone you care about is more angry or irritable more often, or dealing with big changes in appetite or amount of sleep, those could be clues to meet with a professional.
Reach out for help so we don't have those lingering long-term effects.
Yeah, big takeaway in all this. Look at those big issues and then break them down into smaller, more manageable, maybe even daily goals. Now, given the pandemic, I'm told most clinicians and therapists are offering completely virtual appointments from home. And Kaylee, if you have insurance, there is typically no cost out of pocket.
And it's okay to ask for help. It's okay to lean on each other, too. Important to maybe pick up the phone, text someone, say, I hope you're doing okay. John, great job. Thank you for that story. We appreciate it.
Absolutely.